The incidence of COVID-19 infections has been rising globally. We are here today to help you understand how to maintain basic hygiene to be able to keep the infections at bay.
There are certain basic things that we can do to help prevent the spread. Coronavirus has a tendency to be transmitted through touch. Let us talk about hand hygiene, and we are going to demonstrate how to effectively wash your hands. The basic step will be to wash it first with soap and water. If you have disinfectant soaps or antibacterial soaps, that can also be effective, but not to worry, even basic soap and water is as effective. The hand washing ideally should minimum of 20 seconds, but you can even extend it up to 2 minutes. So remember to entirely wash your hands, including the crevices of your hands, and not to forget the spaces between your nails. So it's easy to remember that if you can, in your mind, sing a song of happy birthday, that would amount to 20 seconds of time, which would be enough to completely wash and cleanse your hand. And after you wash your hands, do use a dry towel to wipe your hands, or you can even use air dryers, which are also equally effective in drying your hands. Once you use a dry towel, please dispose it off carefully in the nearest bin without touching the surfaces. If you do not have access to soap and water for effective hand washing, you are free to use hand sanitizer, which are commonly available in all the supermarkets, and it's very portable, which can be carried with you. Ideally, a hand sanitizer should have alcohol content above 60 to 70% for effective hand hygiene. So you can put a drop in either palms, rub your palms effectively, let the hand sanitizer cover the whole of both of your hands, and not to forget the crevices, and let it to dry completely naturally without using any towel, because that will effectively eliminate all viral infections. When do we need to take care of our hands? So after we are in a public place, we might be exposing ourselves to the virus through multiple surfaces. It may be desktops, it may be the chairs that we are sitting on, it may be the door handles, it may be the escalators, even small things that we might not even notice. And even as we go shopping, there may be multiple surfaces where we might be exposed to the COVID-19 virus. The second most important in personal hygiene will be the face mask. We have two kinds of face mask. The first one is called the surgical face mask, and that looks like this. So it has two surfaces, the front and a back surface, and there is a metal piece that keeps the mask in place at the top of the mask. Remember, the most important aspect of using a face mask is to get a tight seal, because if the tight seal is not achieved, there is leakage of air as you inhale, and that could be a potential risk. The second option of using a face mask is what we call an N95 mask. This is a professional mask which is predominantly used in all healthcare settings to contain any sort of transmission of virus. This is a much effective face mask. And also it's very important that you get a tight fitting on your face, and there is also a metallic piece which will also help ensure that it is effectively fitting any sort of faces. It's also important to know that you should avoid touching the face mask if your hands are not clean. So do not touch infected surfaces and then touch the face mask, because that will further expose you to infections by the virus. These face masks should be worn by people who are going in public places, who are traveling on public transports, metros, buses, etc. And if you are passing through airports and aeroplanes, also it is recommended to be wearing the mask in order to prevent the infection. Ideally, face mask should be worn for a maximum up to 8 hours, after which it should be disposed of carefully in a very secure bin which has plastic within them, so that you don't transmit the infection further, because there could be viral particles which could be sticking onto the surface of the mask. And make sure you wash your hands properly before you put the next mask on. And if you are still in a public place, you need to continue to wear the mask and avoid touching the mask at all costs. There are also certain etiquettes that you need to follow when in public places, especially if you are having a cough or a sneeze. Remember always to use your elbow. Do not cough in your hands and you may shake somebody else's hand. So remember always to use your elbow to cover your cough, and that is the best etiquette that one can follow. If not, you can also use a hand tissue. Take it with you all the time. You have those little packs you can carry with you. Use a hand tissue, cough or sneeze into the hand tissue, and immediately dispose it off in the nearest bin in a very proper and safe environment. It's important to understand that we do not have an effective approved treatment for coronaviruses. So how can we help ourselves from this virus in the rare event that we do contract the viruses? Number one, it's to keep our immune system as strong as possible. The number one is nutrition, where you need to have a good balanced diet of all the essential nutritional items in order to keep your immune system balanced and healthy. Number two, not to be ignored, is the amount of sleep that one gives himself. It's important that during an infection with a virus that we get adequate amount of sleep, and that should be nothing less than 8 hours of rest, or even longer depending on how bad you feel. If you are feeling tired, fatigued, my advice is to always listen to your body. Do give your body the required amount of sleep until you are feeling refreshed. And in case you are sick, you need to inform your employer. You need to make the necessary arrangement for you to be staying away from work for a specified duration of time until you are completely healed, so that you will prevent the spread of this virus within the organization.